Hi everyone and welcome to today's presentation. My name is Maria Varela and I am here to present my PICOT question. But first, a little intro about myself. About me. I am Maria. I have my bachelor's in science in occupational therapy. I have been practicing in the healthcare field for over 20 years. For the past 3 years, I have been the biofeedback program coordinator at the organization I am at. I am currently pursuing a master's in healthcare administration, very important. I enjoy exercising and eating well in order to stay healthy and active to keep up with my toddlers. Past experience. I have worked with both adults and children with different diagnoses and limitations. Diagnoses such as stroke, cerebral palsy, autism, traumatic brain injury, spina bifida, multiple sclerosis, stroke, to name a few. Here we have my presentation outline. And PICOT question. Problem: obese adults, intervention, low-carbohydrate ketogenic diet, comparison to a low-fat diet, outcome accelerated weight loss, time frame 1 year. For obese adults, does increasing the intake of a low-carbohydrate ketogenic diet as an alternative to a low-fat diet accelerate weight loss over the course of a year? So, as a healthcare professional, I am constantly working with different patients, including overweight and obese patients. So I thought it was of high importance to further research a diet with faster weight loss and results. The keywords here are faster weight loss. This will allow the patients to see results faster and stay motivated throughout, continuing the diet. Many of our overweight patients have tried different methods of losing weight. Unfortunately, they have been unsuccessful. When you ask why they've been unsuccessful, they all have the same answer. The diet took too long to show me some results. They just lost motivation and simply gave up. Significance of the problem. Obesity is slowly becoming a disease of catastrophic proportions. Regardless of the fact that exercise and food preferences have greatly influenced the number of individuals suffering from this medical condition, the problem continues to persist. Therefore, the quality of life is reduced as obese people face a lot of health problems, for example, diabetes and hypertension. The low-carbohydrate diet has risen in popularity among obese adults trying to lose weight in a safe way that does not impact health in any negative way. As a therapist working with both adults and children, I have much interest in the effects of different types of diets and overweight on obese patients. The combination of obesity and physical limitations can affect the desired treatment plan and exercise regimen within the required time frame. Very important. When treating such populations, we must alter the treatment plan as patients are fatigued, heavier, and not feeling well, while also keeping their safety in mind. Therefore, it is necessary to have another therapist, assistant, or even a nurse available to aid with patients' care during transfers, treatment. These treatment limitations will ultimately prolong our treatment sessions, short and long-term goals. So what is a ketogenic diet? A ketogenic diet is a high-fat diet with adequate protein and very low amounts of carbs. It restricts carbs to less than 20 grams a day. That's very, very little carbs. The goal is to get more calories from protein and fat from carbs. It is known to provide faster weight loss and numerous health benefits, such as reducing the risk of cancer, and improves heart health and reduces seizures. Faster weight loss is important as it is a feature I looked into. As previously mentioned, many individuals quit after starting a diet and not seeing fast weight results. This diet basically works by depleting your body of its store of sugar, so it would start to break down protein and fat for energy, causing ketosis and weight loss. Search strategies. Date parameters were between 2015 to present, nothing older than 5 years, as my PICOT question is a fairly new topic that people have been more into for the past 5-6 years. So I thought it was highly beneficial to keep my articles within that time frame. That way I get best results and research studies and overall good peer-reviewed articles. Main keywords used included ketogenic diet, obesity, low-fat diet, dietary carbohydrate, keto, and obesity. Database search engines included CINAHL, PubMed, Medline, Endocrine, and Google Scholar. Here's my Prisma figure. You have PubMed, CINAHL, Medline, Google Scholar, as previously mentioned, and Endocrine. I found relevant and reliable articles through Google Scholar. During my searches, I concentrated on systematic literature reviews via PubMed and randomized control trials published in peer-reviewed journals. I excluded individuals with diabetes, chronic renal disease at baseline, and those who were currently on a diet or exercise program. My initial search, as you can see here, started with 25. After considering my inclusion and exclusion criteria, I ended up with 6 articles altogether. During my search, I also excluded magazines and studies where the results between both diets were too close, too similar, too close. Didn't make much difference between the low-fat diet and the low-carb ketogenic diet. Summary of the evidence and literature. Findings confirms a low-carb ketogenic diet having greater weight loss results. For example, the participants in the low-carbohydrate group lost 5.3 kilograms in comparison to the participants in the low-fat group who lost 1.5 kilograms in the course of a year. Low-carbohydrate diet helps improve inflammatory status and endothelial function to the same degree or greater degree than those on a low-fat diet. The ketogenic diet shows a better long-term effect for weight loss in obese patients in particular. Due to the patients seeing faster results, they turn the short-term diet plan into a long-term lifestyle. The weight loss is achieved in a healthy and sustainable way. They assess the results and regularly consider adjustments. The keto diet lowers inflammation, and this happens due to the amount of free radical production that occurs when burning ketones for energy instead of glucose. For the proposed model change, I thought I would use ADKAR. ADKAR is a goal-based change management model that can be used to guide both individual and organizational change. As you can see here, ADKAR stands for Awareness, Desire, Knowledge, Ability, and Reinforcement. I will use the meaning of each letter in the word ADKAR to explain the need for change in the obese and overweight population. For example, awareness. It is important for us as healthcare professionals to have awareness of the risks and difficulty when working with overweight and obese individuals. Desire. It is necessary to instill the desire and support and take part in the change amongst our overweight obese patient population, family members, and caregivers, by reminding them of their health risks and limitations. Knowledge. We will provide the patients with the knowledge and ideas of how to make these changes safely. For example, patients will have a full medical evaluation by the primary care physician, and after the primary care physician views the results, they will decide whether the patient is a candidate to continue to actually start a ketogenic diet. Ability. We will have the ability to implement change when demonstrating increased costs and risk to the organization, administration team, and health insurances. Reinforcement. Reinforcement will be used to sustain the change, will be given to patients and family members on a weekly basis for the first month and once every 2 weeks after the first month. The setting for the plan change. I would consider performing my conferences, my PowerPoint presentations at informal venues such as large hospital settings or small clinics, either in their conference rooms, cafeteria, or auditorium. I will also consider doing my presentations at universities, perhaps in the health science department, where students are obviously studying something in the healthcare field and possibly one day be working with individuals who are obese or overweight, and this information and pamphlets will be beneficial to them. Data-based evaluation. Statistical analysis will be carried out using the following procedures: chi-square test, Wilkinson-Whitney test, student's t-test, and pair t-test. The pair t-test, for example, was used in analyzing the data gathered from the study. This is used in comparing two means gathered from similar individuals and related units. The measurement is taken at 2 different periods. It was mentioned that the aim of using a pair t-test is to determine if there is statistically significant difference between 2 paired observations. For the proposed change process, stakeholders for this change process include the obese or overweight individuals, their family members, caregivers, healthcare professionals such as occupational therapists, physical therapists, dietitians, physicians, nurses, dietitians, etc., even surgeons. Current state of the patient. So the patient is obviously unhealthy, they're overweight, they're obese, they're suffering from perhaps pressure sores, possible diabetes, depression, anxiety, you name it. Limited range of motion, endurance. They can have plenty of complications, that including cardiovascular complications. Transition state. The healthy weight loss following the diet correctly, involving physical activity. Modify food plan after the patient has been approved and evaluated by their physician, and they have a green light to go ahead and start the ketogenic diet. Future state, you will see healthy weight loss, gains in mobility, range of motion, and endurance, decreased physical, psychological, and emotional limitations. Practice recommendations. Individuals with obesity will benefit from treatment strategies designed for weight loss that can also foster long-term weight control and prevention of weight gain. The following approaches should lead obese patients to great results when combined with low-carb diet, motivating them to continue following it. Dietary therapy, for example. So after completing the physical, the physician will recommend a specific food to eat and improve overall health. Physical therapy. The physical therapist can help people who are obese be more physically active by teaching them exercise in pain-free, safe ways. Psychology. Obesity can affect social and psychological functioning. Many obese individuals perceive discrimination and prejudice due to their obesity and face stigma of obesity every day. Occupational therapy. The OTs can help obese individuals change their lifestyle, engage in meaningful activities, and manage their weight. Dissemination. Institutional. So we would include patients, families, healthcare professionals, like the ones we previously mentioned. I will present a PowerPoint presentation while showing images of individuals who have lost weight while on the ketogenic diet, before and after images. I will also include real patient stories explaining how they started the ketogenic diet and how it worked out for them and the results they achieved. At the end of the PowerPoint presentation, I will distribute easy-to-follow pamphlets related to the low-carb ketogenic diet, exercise, and its benefits. I will show you that pamphlet briefly. For the local, regional, and national, I will share my results with my current healthcare organization first. If I see positive results and feedback within the organization, I will plan strategies to share these changes and results regionally and nationally. For example, I will consider to host conferences for the Journal of American Heart Association and the Journal of Cardiovascular Nursing. Due to obesity being a major risk factor for cardiovascular disease, I feel including these associations is of high importance. So here's the pamphlets I will be distributing to my attendees in my conferences. This is an easy-to-follow pamphlet with the needed information pertaining to my PICOT question research and results. Here we have some truths about the ketogenic diet, how it is completely safe if followed properly. The intervention. This ketogenic diet goes hand in hand with treatment strategies designed for weight loss. And I will directly address this to my audience, healthcare professionals, students, parents, family members. If your patient or family member is overweight prior to recommending the ketogenic diet, the individual should have recently been completed a physical and given the green light by their primary care physician. Very important. And here we have the references that are given for further clarification of study results and its benefits. And here we have our conclusion. In conclusion, research shows a low-carbohydrate ketogenic diet is indeed more effective in faster weight loss than a low-fat diet. The low-carb diet also resulted in similar or greater improvement in inflammation, adipocyte dysfunction, and endothelial dysfunction. Endothelial dysfunction is a condition where the endothelial layer of the small arteries fails to function normally. As previously mentioned, the ketogenic diet is also known to aid in the reduction of cardiovascular risk factors such as stroke and heart failure, which are known to be major cause of death and disability in the United States. Here are my references. And thank you everyone so much for watching, and I appreciate any comments, feedback, and questions. Thank you once again.